I could tell you one from experience that was a kind of turning point for me as well. And it's actually was a patient who was a dentist. She had been gone around to all these cornea specialists, and she was getting a lot of dry eye corneal desiccation. In other words, the cornea, the front of the eye itself, was drying out enough that it was causing scarring. And there was a lot of discomfort. And a lot of these cornea specialists will go and treat with a kind of a bandage type of lens on the eye and amniotic membrane. They'll treat with different types of medications. They can sometimes even do a small surgical procedure where they scrape off some of the tissue. And, it still is not getting at the root of the problem. So and even somebody like her did a lot of lubrication and did plugs, which helped. But the one thing that really did help is when we did this procedure on her, and it was like a game changer. This is a while ago. I really said, there's really something to this that's about the integrity of the tear film that's crucial here in treating these type of dry eye disease. And even the cornea specialists and everything that she went back to were very, very impressed with this. And we get referrals from these people now. So, so that was pretty much the turning point for me.
Yeah, I have somewhat of a different patient, that's an extreme case as well. But even I have had younger patients. I had a 23-year-old who, for the first time, has now been working at a desk on the computer all day long. He is a chronic contact lens wearer, but never really had these symptoms before where his vision was blurring throughout the day. He was getting this burning sensation. I tried switching his contact lens material. I tried plugs. I tried, different drops for him. And then when I really took a scan of his meibomian glands, which you can do with this device, you're able to see to the extent of his viable meibomian glands. And you wouldn't expect it in someone that's that young, but he really already was having some loss of his glands there. And after I did the procedure on him, he was feeling much more comfortable being on a computer, and hence, he was able to be more comfortable performing at his job. And of course, it's a chronic condition. So he's, we're still treating him chronically, but we were able to improve his quality of life at a younger age, which can have an effect on his future.